ABC4 News.
Welcome back. You may not have known that March is Kidney Awareness Month, so it's a great time to focus on taking care of your kidneys. ABC4's medical correspondent Saray Chin has the 4 things we need to know about our kidneys in this sponsored segment.
The pandemic shined a light on underlying health issues, including kidney disease. The patients are at greater risk for severe complications when it comes to COVID-19. We have Shinley Condi, nurse manager for Intermountain Healthcare Kidney Services. Thank you so much for being here.
Thank you for having me.
We say kidney disease is silent. Why so?
So kidney disease is a disease similar to hypertension where you don't have symptoms. Symptoms in kidney disease do not present until the later stages of the disease process. So earlier in the disease, when it's good to try to intervene and slow down the progression, people oftentimes don't know they have the disease. So early screening is really important, and that's the message we're trying to get out this month as National Kidney Month.
Well, you say obviously detect it early, and that can be hard, but the earlier you detect, the better you can actually battle kidney disease. And you say it's harder when obviously your kidneys are declining. What are some of those symptoms?
So in the later stages of kidney disease, if it progresses to that point, patients will have non-specific symptoms. They could have nausea, tiredness, weakness, difficulty sleeping. As the disease progresses, and really late stage, they're going to have issues with swelling because their kidneys are not able to remove the fluid that they normally remove from their body. So they'll get swelling in their legs. They can get shortness of breath from fluid in their lungs. And those are late symptoms. We want to avoid those. We want to catch this disease earlier.
So it's important to know your risk. What are those risk factors, and diabetes being number one?
Diabetes is the number 1 cause of kidney disease in the United States, followed very closely by hypertension. Also obesity, a family history of kidney disease. There are certain ethnic groups that have higher rates of chronic kidney disease. So we want people to do a self-assessment, ask themselves, do I have any of these risk factors? And if so, start having those conversations with your primary care provider. The National Kidney Foundation has a wonderful quiz that's online. It's free, www.minuteforyourkidneys.org, where you can find out if you are at risk for kidney disease.
When you have those risk factors, and if you don't, is there a certain age where you should check it anyway or get screened?
So kidney disease can affect anyone at any age. Again, diabetes is no respecter of age. So the bigger thing is just to understand your risk factors. If you have risk factors, you should be being screened.
And there is hope, right? Even if you have kidney disease, there is hope out there. And I know Intermountain Healthcare is doing so many great things.
Absolutely. There's so much emphasis right now in the renal healthcare community on finding new medications to help prevent the disease, to slow it down, new therapies to offer treatment at a more convenient manner for patients. So there's a lot of emphasis right now. There's some really big goals within the community to try to improve the lives of people with kidney disease.
Shinley Condi with Intermountain Healthcare, thank you so much for your message and awareness. For more information about kidney disease and treatment, just head over to intermountainhealthcare.org, and we'll have a link on our website, abc4.com. Thanks again.
All right.